All right, IMHO family, welcome back. Welcome back. Thank you for staying tuned to this special edition of IMHO and COVID-19 response and update from my area. As always, you know how to hit us up, IMHO Talk Show online, keeping the conversation going, being there for each other. And, that's why we're here. That's why we have this show. And wanted to follow up once again with the experts in our community, as we give our humble opinions, want to make sure that, people see that consistency, see that unity, and know the resources that are available and that are being sustained for you, for us, the people. And that's why we have with us right now our mayor of this city of Charlottesville, Mayor Walker. Nikuyah, thanks as always for joining us. How are you feeling?
I'm okay. How are you all doing?
Well, I'm blessed.
Doing good.
Doing well.
Good.
Yeah, blessed.
There's a lot going on. I think everybody's pretty overwhelmed and trying to figure it out, but
It is.
we're getting it done. So I'm excited that I can report that.
Right.
Trying to figure out something that none of us have ever experienced, nor did we think we would,
Yeah. That's definitely spot on. That's all we can do. We we all have ways that we can contribute at IMHO, being an outlet, being a resource, for the community to stay informed and connected, straight from the sources. We felt like that we had to, have this type of episode for our people, and so thank you for joining us. And so. Absolutely, always, and just to hand it over to you, from your position, from the city, kind of, I guess you can even take us back, a week or two, as far as you can, as far as how the city, as a government entity, was getting information maybe from the state level and some of the things you had to address.
Mm-hmm. Well, as you know, the information that's been coming down from the federal level that would trickle down to the state and local governments hasn't been as clear as it, needed to be. And so I think initially, just like everyone, and that some people are still grappling with, there was some debate about maybe how strong our response had to be towards this, and whether to close City Hall, close Parks and Recs, limit the number of employees that were in buildings and who came in contact with whom. Those were some of the initial discussions. Did we have to wait until there was, a confirmed case, or could we make that decision without there being confirmed cases? So that's how we spent, probably the first, few days. Making that decision. And then, of course, staff went on to set up the emergency command center and start, really getting things in place to deal with the type of outbreak that we could experience here. And based on the numbers and how they're trending, with the U.S. trending higher than any other country, we're definitely, headed in that direction. So I'm glad that we took that response. I wish we had been able to take it earlier. And, but again, we would have had to have been, taken this seriously in a way, and to have known about the potential dangers, and that information just wasn't coming from the international and national level.
Got you. Okay. So, yeah.
Mayor Walker. Oh, I'm sorry, Joe.
No, I was just going to follow up, and I'll pass it over to you, raise it up. Yeah. So I mean, like, that definitely lends, the belief to, like, where this is actually starting and coming from. And, you as a public official definitely.
I can't hear you.
I'm sorry. Can you hear me? Can the rest of y'all hear me?
Yeah, I can hear you.
Oh, can you hear me now, Mayor Walker?
I can hear you.
Yeah.
Okay, gotcha. All right, sorry about that. Not sure what happened. So, yeah, no, I was saying, as a public official, definitely not gonna, ask you to address any conspiracies or things like that you wouldn't want to, but it definitely roots back to, like, who knew when and where it really started, so people weren't behind the eight ball, because there's a lot of things out there. That's why we're having the show, to have, the voices, the expertise to kind of clarify a lot of things, because there's a lot of uncertainty. There's not really even an end goal right now from our from our healthcare system when it comes to possible vaccination and what have you. So so definitely thank you for that. But Razor, what did you have?
My question for Mayor Walker was, what would you want your constituents, the people of Charlottesville, to do for you? Because it's unfair of what everybody is expecting you to do. Like, they'll ask you to pretty much make presidential decisions just because they want you to. So while you're trying to figure this whole thing out along with the rest of us, what would you ask for the regular community to do?
I think we take heed to messages that we know for sure. I am back that even now, after we definitely know, after we're done and higher than any other, country. I don't have the numbers in front of me this morning, but I think the Thomas Jefferson Health District released that we just with Albemarle and Charlottesville, we have over 40 cases, confirmed now. And that number was just zero,
right.
Yeah, like a week ago.
Yep.
And so to understand that, my fear is that we are not taking this seriously. I see people out, I hear them out, I see some, Facebook posts with people just asking us to move on past this. I'm not sure how much of the social distancing is happening at the level that it should. It doesn't seem like it's happening at the level that it should. And, because of that, I feel like that we may have greater numbers than we should have. So that's what I would like the public to understand. I know that it's an inconvenience. I know that it's completely different than how people live their day-to-day life. They are used to going and doing what, they want to do. But just for this, temporary period that you're able to step away from that norm and just be still. And for those who haven't had much practice with that, to practice, So the social distancing, the hand washing, the, keeping your spaces clean. And again, social distancing means that I can send pictures. I haven't wanted to do that. Like, my daughter was outside on the porch talking to us through the door yesterday because, we are all trying to make sure that we give at least that initial 14 days to where we know that we're good and that we're controlling who we're around. I have to constantly, I don't have to go downtown as much, but I still have to go and be around people. I had to go the other day because I locked myself out of the computer. That was an unexpected trip. And I needed to be down there for, and connected to the system for IT to help me out, to reset a password. It could be something that simple. So I also don't want to, because I don't know when I'll have to leave the house, but for those people, who don't have to worry about because of work or, taking care of family members, that they just, take care of that space. I took my grandparents some food and a few groceries and got my grandmother medicine together. And we have to do that every week, every other week, but I did it from the front porch. I got the laundry brought out the house. I, said, hey, did you put this in the basket? Did you do this? So it takes a little bit more effort when I could have zipped through the house in 2 seconds, having, them go and get everything. But again, wanting to keep, keep them safe. And I know it's a challenge, but that's what I would suggest that we figure out and that we do in greater numbers than I'm hearing that we're doing. Someone sent me a message yesterday and said there are house parties happening. So, no house parties.
Right.
That hurts.
And then I'm challenged with, with that information and, what that means if we have to send someone to enforce that, and that's not what we want. We want people to be able to save themselves, but we also have to weigh the, public health aspect of it, which is major. Because if people start, I think Italy the other day was 900 deaths for the day, right? That's a lot of people that are no longer here. And that is after 400, number of death days, 600, 700, and then the highest toll, I think it was 919 or something the other day. And just understanding that's a lot of people, and you don't want to be on the other side of this saying, oh, all I had to do was just simply stay in the house and somebody I love and care about would still be here.
Yeah, and and that social distancing with me, I recommend some social media distancing as well, because especially we already been on it too much, but now when we get bored, people posting things and starting rumors that's not accurate and things of that sort. That's one reason why we want this to be part of the conversation straight from the from the experts. But that is key. And with the house party things that you mentioned, like one of the big misconceptions is very important is that people think, oh, well, I feel fine, so I can be around other people that feel fine, not knowing that people are testing positive with no symptoms.
Yes. And so just understanding that, and we really do understand that, right? Asymptomatic. And so there have been people in position who thought they were having a sexual encounter with somebody was safe and ended up with an STD. Like, people understand this and allow that if they don't understand. And when you did that act, you didn't think, oh, I was going to leave here with gonorrhea, chlamydia, HIV, or any of, right? So that there are people who you don't know, you can't see it, but it's clearly there. And and the goal there is always to treat everybody as if they are infected, right? And so that was kind of the message when I used to do the work in HIV and AIDS field. That's what we told everybody. You just automatically assume that the person you would be sleeping with is infected, and what do you do to protect yourself from that? And it's the same thing. You can't see this virus. By the time somebody is coughing and hacking and having a fever and physical symptoms, the digestive issues they're saying that comes with this, diarrhea, vomiting, by the time that is happened, that person has been able to spread this between that 2 and 14-day period. So that's why it's important to just stay in your immediate family unit. And even if your sister is right next door or down the street or across town, that's the time where you're going to have to do these, FaceTime type conversation, lots of phone calls, but just being able to just keep as much distance as you can. And then understanding if there are family members who are going out and going into other spaces, that if they think they're okay, that someone in the family, and I know I'm that person in my family, I'm checking everybody. Like, listen, you were here, you did that, you shouldn't be going down there. I put a note on my grandparents' door when I was down there for other visitors. I had to tell my brother, why are you in the house? You have to just be, willing to just keep saying it until they get it.
Yeah.
Hey, Charles.
So hey, Ray, let's take a quick break if we can. And then we can get right back to you, family. We are joined by Mayor Nikuyah Walker of City of Charlottesville, giving us great information, giving us updates from her office, and we much appreciate it. So I know you do too, so stay tuned. We will be right back. IMHO Talk Show.
You're listening to In My Humble Opinion with Maxillia Robinson and Charles Lewis, only on 101.3 Jams.
IMHO Talk Show. You got Sir Charles.
Oh, that's right. You got Razor.
Yeah.
I forgot I'm normally third.
Yeah, that's true. True fact. My bad.
A Rod is here.
Yeah, so you got the fellas for this one right here. I'm speaking with Mayor Nikuyah Walker. And before we went to break, I know Razor has something for you. Razor?
Yeah, this Mayor Walker triggered something when she said something about the house parties, and I know you work for, in the healthcare profession. Mm-hmm. What does the CDC say about spraying people in the mouth with Lysol?
Lord have mercy. Yeah.
No, I'm just saying, and you'll see where I'm going with this in a minute. What do they say about that, like using chemicals to try to combat this
right
this pandemic that we've had?
Right. Well, firstly, let me say that I'm not a medical profession. I'm on the clinical engineering side, but I do know, from being in plenty of meetings, that is not acceptable. Household products, there are actually people dying and they're overdosing because chloroquine is another one. Chloroquine.
Exactly.
That's one thing that's used to disinfect pools. It has worked it's a chemical and an ingredient that's used in small doses for folks who are already on anti-malaria medicine, because that makes them more immune to that chemical in very small doses. So, but people took that and started using it like from the pet store, getting chloroquine from the pet store. And
people drinking Clorox.
Yeah. So anything that would be considered as a hazard and poisonous to you is still going to be poisonous. So it's still a doctor recommendation for what you put in your body.
Yeah, basically what I was trying to get at is people, no home remedies to try to solve this. You know what I'm saying? Because like Mayor said, this is something none of us have ever dealt with before. So that's why I was going with spraying the Lysol in people's mouths and stuff. That's just my way of talking.
Gotcha.
Yeah. And I think it's important for us to take into consideration why people attempt those things, right? Mm-hmm. Because we can't address in our community why we are hesitant to go to the hospital, that we don't think that we're going to receive good care, and that we will become kind of guinea pigs for things, right? And so we have to acknowledge that those fears are there. And that is why, and that is one of the reasons why the best things that you can do is to try to not end up in those places in the first place, so that you don't have to deal with the fears that you have surrounding how we've been traditionally and historically cared for in the medical field.
Yep, absolutely. And Aaron, I'm gonna kick it to you, but that's crucial. As a lot of this is what we're gonna talk, with the good Dr. Hilton next. But is that Black folk in general have already had a fear of the medical profession because of the clinical trials that's been done on us that we know about historically. So just trusting the medical opinion, even the CDC itself. There's an understandable skepticism.
But we do understand washing your hands, cleaning your spaces, right? Yeah. We do understand that. We do understand that to contract something, you have to come in contact. And in this case, it's been clear that you have to come in contact with a person who's infected. And we see those rapid spreads. There's, all the things being shared on social media. There are articles from the international level to the state level, like what's happened in New York. People know people all over the place. People in New York, people in Florida, people in Washington state, people in California. Those are some major, numbers coming out of states, and people who travel. And so, that's the best way to not have to go, but you definitely want to go if you need to go, because the respiratory distress that this illness is causing, a lot of us won't be able to survive that. And I don't think that a lot of people are understanding that. We have high asthma rates in, this community. So even if you're not elderly, which is the age group that they initially, talked about, if you have asthma and whether it's treated or not, your lungs are not in as good condition as someone without, asthma. Do you want to chance your child, even if they're in an age group and they normally, the doctors are saying this is an age group that can survive it? Do you want to chance that with yourself?
That's right.
This virus is wreaking havoc on the respiratory system. Yeah. You don't chance that. You have people who are talking about the fact that they feel like that they are drowning, or they have like an elephant sitting on their chest. So those are some of the accounts from some of the survivors. And a lot of them didn't have the pre-existing conditions.
Yeah, that's right.
You're listening to In My Humble Opinion with Maxillea Robinson and Charles Lewis, only on 101.3 Jams.
Aaron, did you have something?
Yeah, absolutely. Appreciate all the great work that Mayor Walker is doing. I'm not sure. I'm sure that you've been paying attention globally, and this is not to doomsday, but I always like to hear the people that are smart and that are in leadership positions talk about things like this. Obviously, in the UK, they had a soccer club opened up one of the stadiums for hospital beds. We're seeing in New York City, Jacob Javits Center. And a lot of that has to do with the fact that, and as you're well aware, our hospital system set up in New York and just in the United States in general is at capacity for just regular sick people. God forbid having a pandemic. Have there been communications with community partners on a worst case scenario, University of Virginia, about what could possibly happen? And the reason why I'm asking that is because obviously what we see from China, you see from all these other things, people are getting prepared and it's all hands on deck. So any idea that we got, if we can figure it out, let's get it done. How have those conversations been had, if they have been had, and what's our, I don't even think we can say our level of preparedness, but your comfortability with how those conversations have been and what you've been seeing down the pipe.
So what I'll say is that our city manager level to the individual who is actually in charge of the incident command here from the city standpoint is our fire chief, Chief Baxter.
Okay.
I will say that Chief Baxter's just overall concern for he wouldn't just stay in the moment, right? Like what we're dealing with now. Oh, we have 42 cases in our health district. He definitely from day one, along with the other members on that team, the police chief, Chief Brackney, our Associate Director of Social Services, Sue Moffitt, our Human Services Director, Kaki Dimick, and I always hate to start naming names because I know I'm going to forget somebody. But, it has been a priority for them to, since day one. I haven't heard a member of that team who doesn't understand how widespread this could become.
Right.
With saying that, I think everyone, including the feedback that, because I'm not in the room for these conversations, I'm getting updated from a lot of these conversations, and then we're communicating directly with the city manager and some of those top leaders, leadership staff, but I haven't been in the room for every conversation. But the recap that I received from those conversations, everyone's concerned about, it's been in the news that we don't have, and that's just not a national or international thing. Our local hospitals, the two hospitals in our area, they do not have adequate supplies to protect their employees from individuals who would be infected with COVID-19, and it's a very infectious virus, right? So everyone's, concerned about that. Bed space, that is a major concern about that. And there are conversations about where are those other sites that people can be held if they need to self-isolate, be quarantined, and still get, medical care. So those conversations are being had. I am comfortable with the people who are having those conversations and in charge of it. I don't think any of us are comfortable with whether we have the staff, the proper equipment to endure the worst case scenario.
Right. Now, Mayor, and what about the homeless population? There was one good story. I don't know if y'all heard it, Aaron and Razor, but the artist Lecrae, he's in Atlanta. He's going around and giving like Sandy wipes and like portable hand washing stations like to communities that have a high rate of homelessness. So I'm curious, controlling it that way when we think about like Potcham and places like that we have here in our city, Haven, that helps our homeless population. Has there been any conversation around that?
Yeah, so what Pacham and the city, primarily the work of the Human Service Director, Kaki Dimick, what they did was, the way Pacham works is that they have different church hosts for, I think, a 2-week period. And so we had our housing challenge community bouncing around, and then during the day, they didn't have, real stable place. And a lot of people used, especially when the weather's nice, the parks downtown, the downtown mall, the library, places like that. Yeah. And so what has been done to date is that the Haven, there were some provisions that were put in place when that opened, that they couldn't have overnight guests, that they were only allowed to operate during certain hours. So council passed a resolution to, so that could change a week or so, our last council meeting, whenever that was, so 2 weeks ago. And then the Key Center has been open for the men. And so they don't have to go from site to site, that they're in one location. So there has been I can tell you, everyone I've talked to, now again, I don't know how it's working on that direct service level because I'm not there. Mm-hmm. And so I'm always hesitant to say when I haven't talked to everyone who's encountered, but from everything from how we're going to, police during this time, to, the court system, making sure that, courtrooms weren't still filled and that people, our prosecutors, trying to get as many people out of jail because they know an outbreak in a confined area like that would be very difficult for everyone to manage. So, that was significantly reduced by almost 100 individuals who were either released or let out on home electronic monitoring. So there's been a good faith effort.
Yeah, good. Yeah, and the nursing facilities and rehabs are another place that gets that same attention. Because like we said, the elderly are susceptible. So if it gets in, it'll be nearly impossible to control it, right?
Yes.
Yeah. So the last thing that I have for you, Mayor, and again, thanks for your time, is just going forward, right? Moving forward with the folks who may have to be laid off or, not coming in, so not clocking in. We heard about the stimulus package. So, so what can you share with us as far as the city's expectation, of any resource that they may get and to be able to suffice for city employees or businesses within the city? Has there been talks on what resource that possibly could come?
Mm-hmm. So that's been one of the hardest areas to figure out, because if you tell or strongly suggest that people close their doors, then what, right? And so then thinking about how the businesses sustain themselves and the employees. So that's been one of our biggest challenge, that we don't have the capital to be able to fix. And any investment that we made in it may last a month or so, but that's it. And especially when we'll be dealing with this, on that 3, 6, 9, 12, 18 months, like those are the numbers that are out there. So it's not even though we take things 2 weeks at a time, we know that we'll be dealing with this, longer than that. And even if we get a break during the summer, because there's that theory out there that it doesn't, the coronavirus doesn't respond well to heat, there is a lot of concern about what happens and what it comes back as once it gets cold again. But in terms of the stimulus package, because of we are a city of 50,000 people, we won't get direct dollars from the federal government. So we'll have to wait and see how the state divvies out those dollars and send to the locality. And then at that point, we'll be able to, approve some decisions that are suggested by the city manager and staff about where those dollars go.
Awesome. Well, Mayor, thank you. Always doing a great job, and I always love that you were willing to sit and talk to us, and have a transparent office. That's one thing that I appreciate about your time as mayor. Now, you don't have any regrets now for running for re-election, do you? It's getting tougher.
Oh, I mean, listen. Listen, no, it's all good. I'm here to serve.
There you go. We appreciate you. So, Mayor Walker,
yes, we do.
You stay until next time. Definitely stay in touch.
Yeah, thank you for having me.
Thank you. In IMHO family, we will be joined next by Dr. Ebony Hilton, medical profession here locally, and we're gonna dive into that aspect of it. Thank you for staying tuned. IMHO Talk Show online. It's Charles, it's Max, it's Aaron. All right, family. Be right back.
You're listening to In My Humble Opinion with Maxillia Robinson and Charles Lewis, only on 101.3 Jams.